My name is Alex Anatone, and I'm a hip and knee replacement surgeon at the Hospital for Special Surgery. I see patients here in Manhattan and in Paramus, New Jersey. Common conditions I treat are osteoarthritis, rheumatoid arthritis, and other inflammatory arthritis, avascular necrosis, post-traumatic arthritis, and I also see patients who have had prior joint replacements and want another opinion because they have either a worn-out joint replacement, pain around their joint replacement, or a fracture around their joint replacement. As a physician, my goal is to get to know every patient on a personal level before surgery. I want to know everything they've had in terms of prior treatments and what their goals are after surgery so I can design a personalized treatment plan to get them where they want to be. Some patients want to be able to bike again, to ski again, to play tennis. Other patients just want to walk or dance at their child's wedding. So my goal is to make sure that they have pain-free mobility in order to do those things they love. Robotic and computer-assisted technologies are transformative in the field. While I'm still the one operating, I find these to be extremely useful tools in planning and simulating the surgery beforehand so I can be more precise and accurate with what I'm doing intraoperatively. The most common question I get is, when should I do this? And I always tell patients it's not a matter of when you should do it in terms of your health, but rather your quality of life. So to me, the answer is always when you are affected to the point where you feel like the pain is too much for you to do the things you want in life, that's the timing that's best for a joint replacement. To see success in a patient is the best part of the job. Patients come back and they show you that they can dance, or they tell you stories about being back on skis or hiking with their family. For me, that's the most impactful part of the job.